Hello and welcome. Let's talk about macrolides. So, the chemistry is that it is a group of closely related compounds consisting of the macrocyclic lactone ring and deoxy sugars. The drugs in macrolides includes erythromycin, clarithromycin, azithromycin and ketolides. The source is Streptomyces erythraeus. Mechanism of action. Macrolides bind with 50S subunit of bacterial ribosomal RNA and it blocks the amino acyl translocation reaction and formation of initiation complex and it thus inhibits protein synthesis. It may be bacteriostatic or bactericidal. This is a picture showing the mechanism of action of macrolides. Now, pharmacokinetics. It can be given orally. Erythromycin base is destroyed by the stomach acid and so given as enteric coated form. The stearate and esters are better absorbed. The serum half-life of erythromycin is 1.5 hours, clarithromycin 6 hours and azithromycin 68 hours. Distribution. Erythromycin is widely distributed to tissues except CNS and taken up by neutrophil and macrophages. Clarithromycin is also distributed very well and azithromycin penetrates into most tissues except CNS. There is extreme penetration into phagocytic cells. Now, metabolism. Metabolized in the liver and inhibits CP50 enzymes by erythromycin and clarithromycin, but azithromycin does not inhibit CP50 enzymes and there is no drug interaction. Excretion is mainly by bile in case of erythromycin and azithromycin, clarithromycin by kidney. Clinical uses. For diphtheria, coronobacterial sepsis and erythema, it is drug of choice. For respiratory, ocular, neonatal and genital infection, also drug of choice. Pelvic infections in pregnancy, cervicitis, urethritis, community acquired pneumonia, usually by pneumococcus, mycoplasma and legionella. Infection by staphylococci in penicillin allergic patient. For prophylaxis against endocarditis with valvular heart disease during dental procedure. For infections caused by Mycobacterium avium complex, by Mycobacterium leprae, Toxoplasma gondii, peptic ulcer for triple therapy against H. pylori, and infection caused by Haemophilus influenza, azithromycin is highly active. Adverse effects includes anorexia, nausea, vomiting, diarrhea, acute cholestatic hepatitis, fever, eosinophilic rash leading to allergic reaction. And drug interactions. Erythromycin and clarithromycin may inhibit CP50 enzyme and increase concentration of the theophylline, oral anticoagulants, cyclosporine and methylprednisolone. The increased serum concentration of oral digoxin by increasing its bioavailability. Advantages of clarithromycin over erythromycin. More acid stability, better oral absorption, longer half-life, twice daily dosing, less incidence of GI intolerance, more active against Mycobacterium avium complex, more active against Mycobacterium leprae and Toxoplasma gondii. The disadvantage is that the cost is high. Advantages of azithromycin over other macrolides. It is rapidly absorbed, well tolerated, long half-life, long duration of action, once daily dosing, short duration of therapy, does not activate CP50 enzymes, no drug interaction, excretion by bile and can be given in patient with renal insufficiency. So why short courses of therapy? Because it penetrates most tissue very well. Tissue concentration is 10 to 100 folds greater than serum concentration and drug is slowly released from the tissues. Elimination half-life is approximately 3 days. Now, ketolides. The drug includes telithromycin, which is semi-synthetic and metabolized in liver. It is used for community acquired pneumonia, acute exacerbation of chronic bronchitis, sinusitis and streptococcal pharyngitis. Adverse effects include hepatitis, liver failure, prolongation of the QT interval and drug interaction. MLS drugs includes macrolide, licosamide, streptogrim, structural unrelated but mechanistically similar compound and shares same ribosomal binding site. End of the topic.